This is a mission.
The gritty truth is that there are patients who have lived their lives being marginalized.
To change a troubling trend.
One of the many problems with our healthcare system is a lack of diversity in our physician workforce.
To make the future of healthcare better for all.
Healthcare is not a privilege. It is an absolute human right. Whatever your color, whatever your ethnicity, whatever your socioeconomic background, you deserve the best care possible.
The Tour for Diversity in Medicine started as a simple idea.
So many years ago, Cameron and I were sitting on the telephone and we were talking about what we can do to reach out to students who weren't going to be able to attend another conference that we were planning, where we were bringing in hundreds of pre-medical students into a large conference. And we started debating, why can't these students come? And we came up with a number of reasons, be it financial barriers, time commitments.
We realized that there was a need to reach out to students on their own home turf. So therefore, we created the Tour for Diversity in Medicine to use an old method of college tours on a bus and visit schools and bring our advice, our mentoring, our experiences to them.
Over time, a lot of miles have been logged. Many colleges visited. But the tour's success isn't measured in odometer ticks or campus visits. It's measured in the dreams launched.
I've graduated, I have my degree, and I want to see how to move forward with my medical degree.
Rekindled.
It seems so daunting. When you actually talk to people who've made it through who are in school, you know, they're not too far from you.
And justified.
I get really excited. It was very informative.
What other HBCU would you go to if you didn't have the opportunity to go to yours?
And I did the mock interview. That was really helpful. Definitely use that when I began to interview at med schools, the advice that I was given.
I see myself as a MD. I've been thinking about obstetrics and gynecology, helping young women.
I want to be the greatest surgical oncologist that ever lived.
I want to be able to give children ages 0 to 18 free health care.
This is a once-in-a-lifetime experience.
As long as you're prepared, and as long as you're doing what you need to do, taking those small steps, you are very, very likely to be able to get into the schools that you, or the profession that you're interested in.
The tour is now poised to roll on, visiting more colleges and inspiring more minds. But to continue on past successes, more is needed than just motivating mentors. Corporations with like missions are sought for partnerships.
We're committed to issues that pertain to underserved communities. We're committed to certainly supporting issues like the one we're here talking about today in terms of the priorities for the Tour for Diversity.
And I'm here to say that the face of podiatry is changing. That's why I'm on this tour.
There's a disparity in the healthcare system. Tour for Diversity allows us to train young people to help close that gap, to bring people into the communities that live like the folks in the community and look like the folks in the community, to help them get the tools that they need in order to live healthier lives.
The Army needs the best and the brightest, and we think the Tour for Diversity offers us that. It gives us a unique outreach capability to reach out to folks that might not otherwise know about careers and opportunities in Army medicine, ways to pay for medical school and different professional schools. And in turn, the Army gets very competent and capable, inspiring clinicians that can in turn inspire others.
We couldn't afford to pay for this. And I don't think that you understand that you're starting an earthquake. You're starting the kind of movement that we've needed for quite a while now.
Tour for Diversity has been a huge success, and certainly we look forward to continuing the partnership.
We're very interested in expanding to other fields of the healthcare professions. We would like to continue to grow our mentor group so that we have new students coming on. And we want to just reach literally every state in the union at some point.
On behalf of Prairie View A&M University, we really thank you guys and the Tour for Diversity for coming down here and supporting us. And know that your efforts are not in vain and that we will go forward and we will be successful and we will carry on.